very happy to be here again this afternoon with everybody, and especially happy to give a very warm welcome to a friend, a good friend and colleague, Dr. Gustavo, who's coming to join us here today from Brazil. Dr. Gustavo, I met back in Denmark some years ago on the football fields, where he showed considerable Brazilian flair in comparison to my English less flair approach to football. But at the time, Dr. Gustavo was studying for his postdoctorate and doing some fantastic research and very forward-thinking study on the topic of biomechanics and physiology, of course, of conveying these topics to us. Welcome, Dr. Gustavo. It's great to see you.
Thank you, James. Nice to meet you again. It's a great pleasure to meet Dr. John. Pleasure to share some of my experience in this topic that I'm really passionate about, biomechanics.
And I mean, certainly the teaching and information that you readily share with the profession and across the world is fantastic. You know, not just amazing information, but beautiful to look at. And I really strongly recommend everybody to take a look at this, because after today's lecture, I am certain that you'll be wanting more, and your eyes will be just starting to see the possibilities and what biomechanics really is. Cases and not really understanding why some of these movements happen, what some of the problems that just appear during the treatment are, and I think biomechanics is it's like the secret ingredient, and people can find if they can understand this, they can start to predict these things.
I have seen that the knowledge of biomechanics, although we have good books in the literature, the fact is that the books are very concentrated in mathematical calculations, and it's a challenge for the clinician to extract that information and to translate that knowledge into a more simple way and to a more effective way to apply that knowledge in the clinical practice.
As you say, really interesting about that combination of the physics and the calculations and the mathematics, but with the physiological side of your study and your research and understanding. And it is the combination of those two that does really come across in your teaching and content. It's not just theory, calculations on the board, separate from what the clinician is seeing. It really feels very relevant, very understandable. And that is all about engagement and learning and us taking something which we can start to use on our patients straight away, because lots of this we can, all of this we can, but even when we're first starting, understanding these principles puts us in a really, really good position to understand, to learn, and to develop our career in that right pathway.
Yes, I think my teaching style is clinically oriented. We really need some foundation, some theoretical base, but in reality, I just extract that knowledge that is really essential, as the name implies, of my educational platform, that essential knowledge that you are really going to use in some way, in some day in your clinical life, independently of the appliance you use, independently of the school or philosophy you prefer.
Absolutely. And I love how you finished that there.